Hey everybody, this is Dr. Justin Bailey. Thought I would share the psychological perspective of the COVID pandemic that we're all in. We've all heard from virologists and epidemiologists, but I thought it was important to think about how much this spread is due to human behavior. And of course, health psychology really is the study of how human behavior, attitudes, beliefs, thoughts have to do with our health consequences. So we can start at the bottom with apathy. We generally don't do much when we feel apathetic or disinterested in anything. But as you move up this continuum, you can see you start to leave cognitive thoughts like interest and concern and move into emotional reactions. So, terror, panic, denial, these are all poor choices that are usually the result of kind of overwhelming emotions. But fear is right there in the middle. And I know people would say you can't live in fear. And I would agree, but fear can be motivating. There is some healthy amount of fear. Maybe the gap right between concern and fear is where I'm looking for. I worry a little bit that people have too much apathy and maybe a little interest, maybe a little denial that keeps them from acting in the right way. So in this case, we have people who just refuse to wear a mask or have social distancing. Maybe they disbelieve, maybe they're in denial. Maybe they just don't care. When I talk to people, they say that they just aren't worried for themselves, which I understand, especially if they've already recovered from COVID. It is frustrating, I'm sure, to have to wear a mask and to worry about it. But of course, we still think they might be able to spread to other people. So I would encourage people to have a little bit more concern and fear. And even fear, yeah, I would say that, if a bear is attacking you, that having concern is not the appropriate response, right? That we do want to have a fear response. Obviously, we can't keep that up for years and years. Maybe tone it down a little bit towards concern. But the other piece of this I did want to mention was just that somebody in denial looks just like somebody who is apathetic. So you can't always tell the difference of somebody who just literally doesn't have much interest in the topic and somebody who's so terrorized that they're actually in denial. So I think that might be an interesting distinction to consider. If a child gets a hold of a gun, we know who's responsible if something goes wrong. In this case, it's really clear that the gun owner needs to keep it out of reach, keep it locked up, keep the ammunition maybe separate from the gun itself. Most countries have laws about this, for example. But sadly, in the United States, about once a week, a toddler, 2, 3, or 4-year-old, shoots somebody or themselves. Once a week is clearly way too often, right? We would say even one death due to an irresponsible gun owner is far too many. My point here is that the responsibility is crystal clear, but a lot of deaths don't have that much clarity. My next example would be, what if you get hit by a bus? Sadly, in New York City, same statistic, about once a week. Somebody is hit by a bus and killed. And again, that's way too often. Like I would say similarly, like we should do whatever we can to keep that from happening. But here, the responsibility is a little less clear, right? The pedestrian has a role to play, the bus driver, the people on the bus may be distracting, the other people on the street. Maybe it's even more complex than that. You start to look at the way the streets are designed, the way the walk and don't walk signaling is, the street lights, the traffic patterns. Maybe you could even step back and say, well, it's civilization and the way we congregate in masses in cities. We need to rethink things at the system level. My point is just that, here we have an example. We know the cause of death, but it's much less clear about what to do about it. In fact, it would probably be multiple solutions that we would try to enact to lower the number of deaths. Moving out even further, what about air pollution? We think that there might be 100,000 people in America that die every year from air pollution. But of course, it's just a correlation, right? It's not as if somebody's on their deathbed saying, oh, I'm dying from air pollution. Right, we just do the math and we say, well, people who live in places with more air pollution are dying in higher numbers. We think this is the amount that coal plants or other toxins in the air are causing it. But It's not crystal clear. In fact, people argue over that number. The coal plants themselves say that the number is inflated. Environmentalists say the number is too low. If you take into account other things, it's even higher. The solution might be a little more clear, like, let's just lower the number of gas burning or coal burning plants. Seems easy, but again, you can start to see this isn't like a bullet. This isn't like a bus. The deaths are unclear, and I hope you see where I'm going with this. Is I think COVID is more like this at this big level where all we really see are the end results of what's happening. We don't even see the virus, just like air pollution. I mean, this picture makes it seem clear, but a mile away from a coal plant and the air can look great. So COVID is similar, where we're not totally sure who's spreading it to who. The responsibility is shared, and people actually doubt the numbers. The worst part about this particular pandemic, of course, is that it's being spread asymptomatically. When people ask, like, what's the difference between the original SARS in 2003, things like Ebola or H1N1, the biggest difference, of course, is that most viruses spread from somebody who is exhibiting symptoms. Ebola in particular, like, does not spread without blood or other fluids being transferred, and you're pretty clear that somebody's having a tough time. Generally speaking, the only people that get Ebola are somebody taking care of somebody who's suffering from it. So unlikely to turn into a pandemic to the extent that our current COVID-2 is having on us. And again, if Ebola did spread asymptomatically, that would be real trouble, because one strain of Ebola anyway killed 90% of the people who got it. So in a way, this could be a training ground for a future pandemic. I certainly hope it doesn't come to that. But if something spreads as easily as our current one and has a high death rate, then I think things would be really, really different. We're currently at about 103 million worldwide, 2 million deaths. Of course, both those numbers are under dispute. Almost everybody would say that the number of cases is multiples of 100 million. Some people would say 1 billion people on the planet have currently been infected over the past year. It's really hard to say because, of course, these are only the confirmed cases. People have had a test done and had it come back positive. It's probably true that it's a lot, but again, when people make these assumptions, it's just like air pollution, you got to take it with a grain of salt. And in this case, I would say err in the direction of assume you currently have it, even if you've had it in the past. We know there's strains that people can get even though they're immune to one strain of the virus. Maybe a mutation will occur in the future. So to kind of remain vigilant, remain concerned at least, maybe not fearful, but act as if you have it, I think is hard to do. It's hard to keep up, but might help prevent the spread a bit. The number of deaths, of course, could be undercounted, overcounted. I've heard arguments both ways. But clearly, nothing like the flu, right? People used to say, oh, this is just, a bad flu season. And sometimes they use that number, 90,000 a year from, I think it was 2017. They're estimated to be 90,000, 100,000 deaths from the regular seasonal flu. But I would encourage you to consider that that's an estimate, just like air pollution. Those aren't confirmed cases. So here, this year, we've got confirmed cases, at least in the U.S., of 450,000 now. Thankfully, children are not getting infected at nearly the rates of adults. And even if they are infected, they don't seem to be having many problems at all. And here I would say that it's similar to a seasonal flu. There are some problems. I don't want to belittle any child who does have struggles, but we've been lucky to keep some schools open. I'm not going to wade into whether or not schools should be opened or closed. Obviously, Zoom education is inferior to if nothing else, the social education that you get. But I did think this picture was cute. We've got a way to find out how far away you are from other kids. My son has a pool noodle at his school. Mask wearing in children has been extremely high, much higher than in adults, so I find that encouraging. So here's the US numbers. And my point here is just to show that it is very behavioral, right? And that those behaviors have to do with how a country views the disorder, this disease, whether or not we should do anything about it. Of course, we have about 330 million Americans, but the 450,000 deaths represents about 1 in 4, 1 in 5, 25% of all deaths in the world, even though the United States only makes up less than 5% of the population. So some other countries, Australia doing extremely well. Their population's around 25 million, but less than 1,000 deaths. So even though they are a smaller country, their experience with this is much better. Now, of course, you can't compare apples to apples here. Australia is a different population, different culture, different attitude towards it. Maybe a little healthier. The United States is a very unhealthy and older population. So you can say that there are some reasons for these differences. Probably the bigger one might be the ease at which it is to spread around the U.S. because we don't close off different states. We don't close off airports very much. There's so many more ports of entry for the disease. But the big winner, Taiwan, with 23 million people in that country as well, has literally shut it down. They do testing. I think it's something like 100 times the amount that the United States does. They have had very high success. Granted, they're an island. Maybe that's easier to kind of control it. And the people there had already had an attitude of mask wearing. They got hit by the SARS virus of 2003. And really, just about every year, mask wearing is pretty common, very, very accepted in their culture. So that might be a big difference as well. But I did want to point it out. They, of course, require masks everywhere. And this is an elevator where you're required to stand facing a wall. So one of the other big differences, and I get that United States believes in freedom, but the people of other countries really take it very seriously, or their governments require it. So there's a trade-off there of freedom versus the health of the citizens of that country. My own state of South Carolina has about 5 million people in it and 7,000 deaths. It's about average for United States, but obviously very poor relative to other places. So I thought I would compare it to Norway, which also has about 5 million people. So we're kind of comparing equal number of population anyway. Much, much less total cases, but even fewer deaths, right? South Carolina with 14 times as many deaths, given the same population. That is pretty stark. Now, Norway had a bigger shutdown back in March and April. South Carolina decided that 80% of the workers in our state were essential workers. So we didn't really shut down very much at all. But neither of them compared to New Zealand. Again, about 5 million people in New Zealand. The number of cases and deaths, very, very different. So my point is just that human behavior is a huge predictor of how this virus actually got spread. What are some predictors of mask wearing? Probably the lowest one is just population density. So people in cities wear masks a lot more than people in rural communities. That's not too surprising. As we move up, a better predictor is just your own personal experience. If you know somebody who got sick, if you're a healthcare worker, certainly if you know somebody who's died, that predicts that you're going to wear your mask a lot more. So a lot of people I know don't wear a mask, and they say they don't believe it. They don't see anybody who gets sick from it. And some people literally believe it's a hoax. If it's spreading within a community, it usually gets some news, right? So people hear about it and they hear other people talk about how they've got friends. That's a predictor as well, similar to personal experience. But it is interesting that mask wearing goes up and down. It goes up when the hospitals fill up. It goes up when the death rates go up. But when the hospitals start to, get their patients to recover and it's not as spread in the community, then people stop wearing their masks, which of course creates the virus to spread even more. So it is interesting. The time to wear a mask is about a month before the hospitals start to fill in, but nobody's seeing it then and nobody's as worried about it. So I find that interesting. Age is obviously a a big predictor since this does affect people over the age of 65 much differently than younger people. Already mentioned, it barely seems to harm children statistically anyway, that often. About 13% of the deaths are people under the age of 65. So it can be lethal. More common, it's hospitalizations, which I honestly feel like we don't talk too much about, and maybe enough about, as the death rate is, all consuming is what we tend to report on, tend to think about. But hospitalizations are quite scary as well, would certainly ruin somebody's athletic career, for example, if you had permanent lung damage. And right now we're finding about 75% of people who leave a hospital, if they were hospitalized from COVID, they have health problems 6 months later. They have symptoms of COVID that seem to be very long term. So that definitely worth pausing and thinking about. But interestingly enough, out of all these, the best predictor of mask wearing, at least in America, is political affiliation. And this is interesting to me just historically because conservatives tend to be more worried about viruses. In the past, they've reported being more concerned over the first SARS, H1N1, Zika virus, Ebola, HIV. And just suddenly this year, that's flip-flopped, where liberals are much more worried about it, even though in the past they have not been. This has to do with personality traits, and I would encourage you to look up Jonathan Haidt's work on the fact that conservatives tend to be easily disgusted more. They're more likely to be fearful of new things. They're less likely to travel, less likely to move, more likely to stay wherever they were born, and more likely to be rural. All those traits kind of fit in with this idea towards the virus. And of course, that leads us to people deciding not to wear a mask and then huddling together. So we know that Herman Cain likely got COVID at a Trump rally and ended up dying a month later. We estimate maybe 700 people have died from Trump rallies. So political affiliation absolutely has had an impact on how the consequences of our behaviors end up. In the Netherlands, they're trying to create little greenhouses for people. These next few slides just kind of show the creativity of people trying to deal with this virus. Is this going to be the new normal? I don't know if I'm going to get in a bubble, but you can see the desire to move on, try to move back into the economy, still have restaurants that work. In this case, I worry about the waiter and waitresses. We're basically just creating more indoor environments, maybe. But I love the creativity, and this is the economic spirit, right? Trying to figure out what are some ways that we can go back to being out in public, maybe even be at a restaurant, but somehow be safe. So again, I'm not sure how many of these are going to be with us in the future years. But my heart definitely does go out to restaurant owners, travel agencies, bar owners. I know somebody who opened up their bar. Their dream came true when they opened up their bar in January of 2020. Really tough timing. But overall, however, the whole idea of trying to open back up has backfired, right? The countries that opened up the most actually had the worst economic outcome of 2020. So this is just the second quarter I found a graph of, where the United States and Sweden, for example, really suffered in the second quarter, even though they were much more open, much more likely to let people go back and have businesses open. But places like Taiwan, which totally shut down and made it illegal to have anybody more than your own household be out in public together. Finland, Norway, they also were much more tougher than Sweden, for example. But they didn't have nearly the economic response. So it is kind of interesting that people's argument for risking the health of others was that we got to keep the economy going, and the results are pretty much the opposite. There are certainly exceptions, but for the most part, the more a country took this seriously, the better off they're doing economically. So Taiwan, another example here, third quarter did really well. They've only had 7 deaths at the time of the writing of that article. New Zealand doing really well economically. Australia again. They went go hard, go early, and ended up reaping the reward from that. And then again, places like Sweden and the United States had much worse economic results from this, and it's partly because, of course, that the virus is so common that people are still scared of it a year later. We just have not gotten our hands around it at all. We're not doing contact tracing. We're not really doing much to work on it. It might change a little bit, but we're basically just sort of decided to wait for it to either burn through the population or let the vaccines handle it. So this is kind of an interesting question that I ask my students. I say, hey, which of these bonuses do you want? A, 10% bonus, or B, a 2% bonus. However, there is a catch. If more than 15% of the class picks A, then I'm giving nobody nothing. And in all my years of teaching, I've never given any bonuses, right? Always, always, always more than 15% of my class picks A. What's the point here? People tend to see their own personal benefit, even at the risk of everybody. I hope you can see the parallel I'm trying to make here, right? That people tend to act in a selfish manner, even if it was going to hurt everybody. So the 2% bonus would be the smarter route because you'd rather have 2 than 0. By the way, about 40% of my classes tend to pick A, so it's not even close. This, of course, is called the tragedy of the commons, where people will selfishly use more of a public good and end up hurting that good. The biggest example might be in the Atlantic, where we overfished the cod for personal economic gain and ended up overfishing, right? I ended up having very few fish left. Same thing is happening with logging and other environmental issues, but I hope you can see the parallel here with COVID, is that people are personally wanting to benefit and aren't willing to sacrifice for the greater good. We've all seen things like this. This is the greater good, right? If you are that one person infected at the top, you could stay home or at least wear a mask and socially distant, and you might be able to keep 244 people from getting it. Oh, I should say this assumes the person doesn't wear a mask in public, right? We think that the spread would be about 2.5 cases for every person who's infected. Lots of people I know say they have spread it to their roommate or maybe one family member. Maybe they'll admit that a couple people got it from themselves, but they all seem to say the same thing after that. They're like, well, so therefore I didn't cause any harm, right? No big deal. I gave it to one person and they're fine. But I think that mentality is short-sighted. We don't tend to think exponentially in our brains, right? We've lived a linear life, and the only way to truly appreciate exponential growth is with a calculator. It just doesn't come naturally. So most people aren't thinking about the 6 degrees of separation to those 244 people a month later. And most people don't know anybody who's died, right? That's days, months later even, where they don't know that they are the one that spread it to the bigger group. So yes, very few people die, but out of 244, now we're talking about much more likelihood of somebody getting it. People have often asked me, why am I so concerned with this? You know, I'm pretty healthy. I'm not in a bad age group or have a preconditioned problem with COVID, but this is why I'm concerned. I wouldn't want anybody to be hospitalized, much less die from my inability to keep the infection with me. And you have to assume that you're infected. Again, that's called the precautionary principle that health psychologists try to recommend. So what if we just infected 1.25 person instead of 2.5, right? What if we limited the exposure by about 50%? It has tremendous impact that a month later, only 4 other people get it. So again, we realize we're probably never going to keep the spread from happening. And we're probably living with COVID like the seasonal flu from now on. The question is, how are we going to handle it? And of course, our goal is to move to one person infecting less than one person on average. You know, maybe better to think of it as 10 people infecting 6. But eventually, if it's less than 1, it will actually decrease in the future. So this is our goal, and This is the piece that I'd like to harp on with many people, especially people who have already gotten in COVID or already get vaccinated. We're not totally sure if you can't spread it anymore. So we're still going to be dealing with people maybe feeling apathetic or in denial about it in the future. So I would encourage us all to consider this graph as how important it is to just move towards less spread. I want to do an analogy to the Haiti earthquake of 2010. A lot of people look at this picture and assume that the buildings that got totally demolished must have been the older buildings, but in fact, it was the opposite. The building up front is built in like the 1960s, where the buildings that just got totally crushed were newer in the 1990s and 2000s, early 2000s. So why is this? Well, it's called the safety paradox. The safer somebody feels, the more risky they are going to be. And back in Haiti, the building codes got less and less stringent over time. Why is this? Well, in the 1950s, Haiti suffered from a series of earthquakes, totally devastated their country, so they had building codes. Buildings built in the 1960s and the 70s built really well, expensive materials, and took longer to build, but no earthquakes, right? The earthquakes there weren't many in the 60s and 70s. So by the 80s, people are like, why are we building it so nice? Let's save some money. They changed the building codes, and then in 2010, most of the buildings that went under were the newer ones. Obviously, the analogy I'm trying to make here is that when people feel safer, they take that mask off, right? They think the vaccine's going to help. One word of warning, I certainly don't think this is going to happen, but it is worth considering that new mutations could affect children more, could affect young adults more. We're not totally sure that the vaccines are going to work with all the new mutations. And again, there's plenty of people who say they refuse to get a vaccination. So I think we're going to be dealing with COVID at some degree for quite a while. And the safer you feel, the harder it is to wear that mask. But I would encourage you to take the lesson from Haiti about that. So that's all I have for today, but I wanted to get a conversation going. Please let me know if you have any reactions, and thanks for watching.